When we decided to do a follow-up to the Truth About ADHD Awareness Month, we figured it'd be we wanted to take a moment to recognize all the other awareness months happening right now. But give two ADHD women a microphone, a list of observances, and a little hyperfocus, suddenly that quick follow-up turned into a full-blown two-parter.
Because once we started connecting the dots, we realized October isn't just full, it's reflective. Every awareness, every story ties back to how ADHD weaves through our lives.
Our first of two parts, we're going to dive into the body, health, hormones, and all the ways that ADHD touches what's happening underneath the surface. Disclaimer, we're not doctors or therapists.
We are certified ADHD coaches, but this podcast isn't coaching.
We're two late diagnosed women talking about what it's actually like to live with this stuff.
So take what resonates, leave the rest, and remember, you're not alone.
First, let's talk about that big pink ribbon that's plastered to everything all through the month of October. Breast Cancer Awareness Month, because this one lands for a lot of us. About 1 in 8 women in the U.S. will be diagnosed with breast cancer in their lifetime. The interesting fact about this that most people do not know is around 85% of those cases happen in people without a family history of the BRCA mutation. Most breast cancers are not hereditary.
Which means prevention depends on actually getting the screening. And that's where ADHD trips people up. The system assumes you've got reminders that work and executive function to spare. You get one portal message and a postcard, and then it's gone under the doom pile.
For me, I had dense breast tissue. And for years, my mammograms and ultrasounds looked fine. It wasn't until an MRI, something I didn't even know to ask for, that they found my cancer. And just for clarity, I did not know that 85% of breast cancer is not hereditary. I learned that after my breast cancer diagnosis because we did not have it in my family. But when they did find my cancer, they estimated that it had been there for around 4 to 6 years. So if you have dense breast tissue, talk to your doctor about whether an MRI screening makes sense for you.
For ADHD folks, accountability helps more than alarms. Find a mammogram buddy. You schedule hers, she schedules yours. It's easier to follow through when it's not just about you, and both of you can get it done.
Exactly. We joke about having 100 reminders on our phone, but reminders don't help if your brain can't convert them into action. Sometimes the best support is human, not digital. Next up for awareness would be Dysautonomia Awareness Month. This one isn't officially listed by the CDC or the HSS, but it should be, because Dysautonomia Awareness Month belongs right in the middle of this conversation. Dysautonomia happens when the autonomic nervous system, the part that controls your heart rate, blood pressure, digestion, it stops regulating properly.
The most common form is POTS, and it overwhelmingly affects women, many of them neurodivergent.
Studies show major overlap between ADHD and dysautonomia. Up to 50% of people with POTS report ADHD-type symptoms like brain fog, executive dysfunction. And because it's invisible, it's often brushed off as anxiety. If you've never heard of it, and we know it's a freaking mouthful, check out the Dysautonomia Project.
Their book is written for both patients and clinicians, and it's what health literacy should look like. Resources that help people understand each other, not just a stack of handouts that you'll never read. And we'll put a link for it in our notes, right?
Yes. The book really is just too cool. It is part of what I use to help get to a diagnosis eventually, because so many people are told that dysautonomia is rare. It is not rare within the ADHD community. It is not rare within the autistic community. These are things that become difficult because doctors do not realize that. They don't want to check you for these things because it is a diagnosis of elimination. And many people, it takes 8 to 10 years to get a diagnosis. Once they realize something is wrong, they typically spend a lifetime being misdiagnosed, just like with ADHD and other things, because the doctors don't know how to connect the dots with these. And that's why the Dysautonomia Project book is so important. It literally reads, on the left side of the page is for patients. On the right side of the page is for doctors. And it lines up. It is layman's terms and medical terms in the same exact spot, which you can read through. And then you have the ability to understand what this is and understand how it is affecting you, and then turn it around and point out the doctor side, the medical side, to your doctor so that they can then recognize what you're trying to say to them. And we all know when we are going into a doctor's office, it can be very difficult to explain what we think is going on, or that we have serious issues with medical gaslighting. And the Dysautonomia Project is a national project that is really putting its best foot forward, trying to connect the doctors with the patients.
That is a brilliant idea. You're right. I wish there were a lot more health documents written that way that you could
I've never seen one written that way.
How genius.
Mm-hmm.
Next up, National Physical Therapy Month. Physical Therapy Month matters more than people realize. Many of us with ADHD deal with hypermobility, chronic pain, or coordination issues and have no idea it's connected.
You end up in physical therapy for ankle pain, shoulder instability, and think it's random. But for a lot of neurodivergent folks, it's part of how our nervous system and connective tissue work. And pain makes focus harder, which loops back into everything else.
We need more PTs trained in neurodiversity-informed care. People who know that executive function challenges make home programs tough and that demand avoidance can kick in fast when something hurts. And that is so true.
The goal isn't perfection, it's persistence. And if our physical therapists understand these things, we will receive the care that we need. If you're in therapy, ask for shorter routines, visual instructions, or even check-ins. The point is to keep moving, not to do it flawlessly. And it's okay to ask for your PT to do this. You are the client. I feel many times, because in these situations we are labeled as a patient, that we also forget we are the customer. We are paying for a service.
And paying a lot for it.
Yes, and paying a lot for it.
Health Literacy Month. Our healthcare system runs on executive function, appointments, insurance portals, refills, and that's exactly where we all struggle.
I literally had to look this up for literacy to understand and make sure that I knew what we were talking about. But it isn't just about patients understanding doctors, it's about doctors understanding patients. Neurodivergent health literacy has to go both ways.
If you've ever left an appointment completely overwhelmed, that's not you doing it wrong. That's a communication failure. We need doctors to slow down, use plain language, and give written or recorded instructions.
And for us, building systems helps. Written notes, shared calendars, medication trackers. But the bigger change has to come from the providers who understand ADHD. Neuroaffirming, neurodivergent affirming healthcare. That is, I feel, the ultimate goal for all of us, or at least it should be. This has to come not from us trying to be perfect patients, but from our care providers understanding we are a different type of patient. If you want something to bring to your next appointment, the Dysautonomia Project offers a free printable clinician conversation guide, which we will link, that works for anyone navigating complex or chronic conditions.
Ingenious.
Right? They are really doing a lot of good work at the Dysautonomia Project.
Just crazy.
They are getting it right. I know we're covering a lot of awareness, but here we come with some more. Mental health, depression, mental illness awareness. And these are a lot of dates to cover. For Mental Illness Awareness Week, we did miss it as far as recording. It ran from October 5th to 11th. The World Mental Health Day was last weekend as well on October 10th. The National Depression Screening Day does land right in the middle.
So many of us were diagnosed with depression or anxiety years before anyone noticed ADHD underneath. Overwhelm never left. It just kept changing names.
Therapy works, but it works best when your therapist understands ADHD. Traditional cognitive behavioral therapy, so CBT, can miss the mark if they don't know what executive dysfunction or rejection sensitivity actually feels like. Attitude Magazine just released an article on this as well, discussing the adjustments that need to be done in CBT therapy for those with ADHD and how it can make an impactful difference understanding what needs to be done and what needs to be changed. It is okay to ask, do you have experience with ADHD clients? That question is self-advocacy. And again, you are not only a patient. You are a customer. You are paying for these services. It is not a source of embarrassment and it should not be a source of miscommunication or lack of communication. It is okay to ask. You are not too much. You are not asking too much. You are not bothering anyone.
And I was very pleased. I just saw the article as well, and I was very pleased to see it, that they, because CBT is so often recommended, but the idea of just making sure that you're with somebody who can approach it a little bit differently, or have, keep your ADHD in mind. So that's great. We'll also, another link we'll put in the notes. And if you've been treated for depression for a long time, but still struggle with planning, starting, or finishing things, it may help to talk with a qualified clinician about whether ADHD could also be a factor. These conditions can overlap, and getting the full picture means getting the right support.
We want to make sure to add the disclaimer yet again. We are not therapists, and we are not psychologists, and we are not clinicians. We cannot tell you what to do. We are just giving data and information and options for you to look further into, vet for yourself, and decide if it's appropriate for you. Everyone is different. We're already to the outro. Woohoo!
Well, we're good.
All right, so that's it for part 1 of October is Loud. We started with the body, the screenings, the systems, the sensory overload, because that's where ADHD and awareness meet.
Next time, we're shifting to the world around us: relationships, identity, and advocacy. Take care of your body this week, hydrate, rest, and if you can, make that appointment you've been avoiding.
And we'll see you in part 2.